Well, welcome back to Balanced Health. And joining us now is Dr. Karen Burgner from the Dreyer Medical Clinic. And she's going to talk with us about chronic fatigue syndrome. Welcome, Dr. Burgner.
Thank you.
Appreciate your coming. And this is something that, that I said at the beginning of the show, 800,000 people estimated in this country are suffering with. And how often do you see it in your practice?
Not as often as you would think. However, fatigue is probably one of the biggest reasons people do come in to see me.
Really?
The question is whether it's chronic fatigue syndrome or something attributable to another medical problem, which is the key thing that you need to discern.
Sure. And what are some of the other diseases that would cause this fatigue, chronic fatigue?
Any major illness, actually. So things you need to make sure, is the heart working properly? Does the patient have something like heart failure? Is the liver working all right? Do they have COPD or severe anemia or another major problem that's really causing the fatigue? Are they depressed?
Okay.
Those are really the key issues. And then once you've done a reasonable medical workup and excluded most of the more common things, then you're left with looking at something like chronic fatigue syndrome, and then you need to address that more specifically.
Well, let's tag the word depressed, because when I went through chronic fatigue syndrome in 1986, the doctor said, well, I feel that you're depressed. I said, do you feel like you're depressed? I said, well, because of the fact that I can hardly get out of bed in the morning, yeah, I'm pretty bummed out.
That would make you depressed.
I didn't start that way.
Yeah.
Right.
So, I mean, you got to work this through with the patient, right? I mean,
Absolutely.
how does a doctor kind of go about, because, you know, patients aren't always going to tell the truth. I watch House all the time, and he says they all lie. And
hate that show.
I love that show. And but it's the truth. I mean, patients could be less than forthcoming for a myriad of reasons, not the least of which what you might think of them, right? So, how do you kind of differentiate whether the depression was there first and the fatigue's part of depression, or that they're now feeling so lousy they're bummed out?
That's actually one of the hardest things to do in the office setting, and that's something that unfortunately that takes time in the office. You have to talk to them, you have to figure out together really what is going on. And unfortunately with chronic fatigue, a lot of times the patients will also have depression as a comorbid, as a second condition. So you have to clarify if this is pure depression or if this is chronic fatigue syndrome or a myriad of other diseases that also has depression associated with it. Does everybody who has chronic fatigue syndrome have depression? No. Does everybody with depression have chronic fatigue? Absolutely not. On the flip side, you need to look for both in each patient to make sure that you're treating what is treatable as aggressively as possible.
If a patient of yours comes in and nothing comes up in the other tests to show that they have other physiological problems, my question is, if they truly have chronic fatigue, are there any physiological changes that would indicate that? Swollen glands or fever or anything that goes along with CFS?
When you talk about the diagnosis of classic chronic fatigue syndrome, there are some associated symptoms and signs that are fairly classic. A chronic sore throat is definitely on the list. Patients will often have swollen anterior chain lymph nodes that are somewhat swollen intermittently. They will have low-grade fevers. Not high-grade fever, say in the 102, 103 range, but 99 to 100 degrees is not uncommon. Additionally, they have multiple other symptoms, the fatigue, the muscle aches, the headaches, and usually those are present for at least 6 months.
Really?
And they've had a negative workup that has excluded other causes.
Well, when CFS first hit the scene in the 80s, they needed to find a culprit. I mean, it's part of what goes on there. And Epstein-Barr virus was the culprit that they were tagging it to. And I guess they kind of get there just because a good percentage of the people diagnosed with CFS had elevated antibodies for Epstein-Barr. Where's that at? Are they still looking at that as a causative agent, or they just don't have a clue?
Unfortunately, at this point, I think not having a clue is probably closer to where we are. We've looked at multiple viral causes, multiple bacterial causes, and unfortunately at this point, there really isn't a definitive agent that we can say causes it. Epstein-Barr was definitely a target organism that we were very interested in. However, as we've looked at it, it's not consistently present in everybody with CFS, and more telling, people in the general population who don't have CFS also will have elevated EBV titers. So it's not necessarily a marker for CFS. Other things that have been looked at include Lyme disease, HHV6, which is a related virus to herpes, or excuse me, to EBV, and HHV7 has also been looked at, and these agents have also been found not to be the causative agent. So at this point, researchers are really still trying to figure out what causes this.
Is it true that women are more prone to it than men?
Absolutely, and that's, again, not entirely clear why. It's thought that there is an autoimmune component, and women in general are more prone to autoimmune diseases, likely due to our exposure to increased numbers of antigens because of pregnancies. However, that is not entirely elucidated at this point, and so we'll need to see what the researchers come up with in the next few years to figure that out more.
Going back to the depression part of it, because so many people share their stories of the cycle of the doctor said I was depressed, so they gave me Paxil or they gave me Ativan or something, an anti-anxiety drug, and that might make them feel whatever, but it's not curing anything. Do you, to implement this, do you often suggest maybe that they see a therapist, because that therapist in their setting, it's different than yours, can they help determine which came first, the chicken or the egg, the depression or the chronic fatigue syndrome?
Absolutely, and two of the mainstays of treatment in chronic fatigue syndrome are, number one, cognitive behavioral therapy, which is where the therapist would come in, where you essentially have a therapist work with the patient very individually, very intensively, 2 to 3 hours per week for 16 to 20 weeks to try to help them just come to terms with their disease and help them reframe how they build their lives so that they're more able to cope with the limitations that the fatigue imposes on them. Number two, we also try to get people into graded exercise programs, often with physical therapy, so that the patient isn't allowed to quote unquote overdo it so they end up exhausted and in bed, but rather slowly, gradually build their exercise tolerance up so that they can hopefully get better.
That's great, because one of my questions from a viewer has to do with exercise, so we'll get to that a little bit later. But for more information, check out www.tln.com and click on shows and then click on Balanced Health, or you can call 888-242-9393 for a copy of today's show. And coming up in our healthy cooking segment, savory spinach tortellini soup that could be a meal in itself, so stay with us.